You're holding the prescription, Zoloft, 50 milligrams. Your doctor said it'll help with anxiety. But here's what she didn't tell you and what you absolutely need to know before you take that first pill. Hi, I'm Dr. Air, Integrative Psychiatrist and Lifestyle Physician. Today I'm breaking down 10 critical facts about Zoloft that most doctors don't have time to explain. You definitely want to know about number 7. But first, let me tell you about Sophia. She's 46, high pressure job, aging parents, teenagers at home. Anxiety had been building for months, racing thoughts, chest tightness, trouble sleeping, worrying excessively. Tired but wired. Her primary care doctor prescribed 50 milligrams of Zoloft. She took it for 3 days and felt worse. Nausea, jittery, more anxious than before. She booked an appointment with my office and showed up for the first visit in a panic. Is this normal? Should I stop? Here's what I told her and what I wish every patient knew before starting. Number 1, Zoloft isn't just for depression. Zoloft Sertraline is FDA approved for 6 conditions. Major depression, yes, but also obsessive compulsive disorder, panic disorder, PTSD, social anxiety, and premenstrual dysphoric disorder, PMDD. Zoloft works on your brain serotonin system, and serotonin affects mood, anxiety, sleep, digestion, and even pain perception. Number 2, it takes time to work. This is where most people get frustrated. You won't feel better tomorrow or next week. For depression and anxiety, Zoloft typically takes 4 to 6 weeks to reach full effect. Some people notice subtle improvements in sleep or appetite within the first 2 weeks. But the real mood shift, that takes patience. Zoloft takes time to work because your body needs days to build up a steady level of the medicine, and your brain needs time for the helpful changes to occur. That process takes time, like physical therapy for your nervous system. Number 3, the first week can feel rough. Remember Sophia? Her nausea and jitteriness were completely normal. The most common early side effects include nausea, headache, diarrhea, fatigue, and increased anxiety. Yes, increased anxiety. It sounds backwards, but it happens. Here's the key. These side effects usually resolve within 7 to 10 days as your brain adjusts. If you're midlife and already dealing with chronic stress and hormonal shifts, your nervous system may be more sensitive to these initial changes. That doesn't mean the medication won't work. It just means your body needs time to adapt. Number 4, starting dose matters. Most doctors start adults at 50 milligrams daily for depression. But for panic disorder, PTSD, or social anxiety, the starting dose is often 25 milligrams. Why? To minimize side effects. Lower and slower can make all the difference in tolerability, especially because anxiety can initially worsen when you start taking this medication. If you're sensitive to medications or have a history of side effects, ask your doctor about starting at 25 milligrams. Number 5, sexual side effects are real. Let's talk about what nobody wants to discuss. Sexual dysfunction affects both men and women on Zoloft. In clinical trials, 8% of men experienced ejaculation problems compared to 1% on a fake pill, also known as a placebo. Both sexes may experience decreased libido or difficulty reaching orgasm. This becomes more common as we get older, especially when combined with hormonal changes. If this happens, don't suffer in silence. There are strategies to manage it: timing adjustments, dose changes, adding other medications, or switching to a different antidepressant. Number 6, don't stop suddenly. Zoloft has a relatively short half-life. That means it leaves your system faster than some other antidepressants like Prozac, which has a longer half-life. If you stop abruptly, you may experience discontinuation syndrome. This shows up as dizziness, brain zaps, irritability, headaches, and flu-like symptoms. This isn't addiction, it's your brain readjusting. If you have to stop Zoloft, always taper slowly under medical supervision. Number 7, it can increase bleeding risk. This one surprises people. Zoloft affects how your blood platelets work, which can increase bleeding risk, especially when combined with aspirin, ibuprofen, or blood thinners. If you're taking this regularly, tell your doctor. If you need surgery, your surgeon needs to know. Number 8, screen for bipolar disorder first. Before starting Zoloft, you should be screened for bipolar disorder. Why? Because antidepressants can trigger manic episodes in people with undiagnosed bipolar disorder. If you've ever had periods of unusually high energy, racing thoughts, impulsive behavior, or decreased need for sleep, mention this to your doctor. This may have been a previous manic or hypomanic episode. Number 9. Serotonin syndrome is rare but serious. When Zoloft is combined with other serotonergic medications like certain pain meds, migraine drugs, or supplements like St. John's wort, it can cause serotonin syndrome. Symptoms include confusion, rapid heart rate, high blood pressure, dilated pupils, muscle rigidity, and fever. This is a medical emergency. Always tell your doctor about every medication and supplement you're taking. Number 10. It's not a magic pill. Here's the truth most people need to hear. Zoloft works best when combined with lifestyle changes, sleep, movement, nutrition, stress management, therapy. For adults navigating chronic stress, cumulative life pressure, or hormonal shifts, medication alone rarely solves everything. But when paired with root cause healing, that's when transformation happens. Sophia stayed on Zoloft. We decreased her dose from 50 milligrams to 25 milligrams for a week before increasing it back to 50 milligrams. We did micronutrient lab testing, then added magnesium and omega-3 fatty acids. We also worked on her sleep and encouraged improved nutrition and regular exercise. Within 2 months, she felt like herself again. Talking about supplements, check out this video for the most important supplements I recommend to improve your mental health.